Today we're going to talk about the heart, but no one's really talked about this subject or this vital organ in terms of what humans do over the course of their lives to deteriorate it or destroy it, which obviously then leads to some major illnesses.
I would say 99% of all people coming to this planet have a healthy heart. And we take it for granted that our heart is always working well, bringing us through our lifetime. But basically we challenge the heart also every day by not obeying natural rules like taking good care of the heart, for example.
So when we're talking about a healthy heart, just visualize it for our viewers. What does a healthy heart look like? What can it do?
Well, to explain this easily, the heart has probably the size of a fist. So a big man has a bigger heart, a small woman has a smaller heart, and it pumps blood through your body, depending on how much you exercise, between 3 to 5, 6, 7 liters. Yeah? And it is basically the engine running your body.
When you said pumping blood between 3 and 7 liters?
Per minute, yes.
Per minute.
So there's every organ in your body has a certain need for blood because you need oxygen, you need nutrition, you need to feed the body with blood. And the heart is basically the organ which makes it possible. And if the heart has a problem, the whole body has a problem.
So it's like the air control that drives traffic of the blood in and out and distributes it, or you can talk in terms of a transportation system where it gets the blood to the other organs of the body.
Yes, absolutely.
So what do we do over time, or what don't we do over time that has an effect on this vital organ?
It's our lifestyle basically which makes our heart sick over time. We're living now in a society where everything is made easy for us. We have remote controls, we don't move that much anymore. We don't have to open the garage door anymore. We push a button, everything is done automatically. So this would be one major factor. The other one, what I think, is that the lifestyle we're living also comes with unhealthy food. Unhealthy food brings up your cholesterol, brings up your blood pressure, has an impact on your blood sugar, and all these factors basically contribute to the fact that the heart is eventually getting sick.
But what are the signs that people can experience, and these are not so great signs, that people can experience and say, you know, hold on a second, my heart might be in trouble?
Most of the time, people have a problem with their arteries of giving blood to the heart. So the heart also needs to have some nutrition, oxygen, and when there is a problem that this blood reaches the heart, patients usually get shortness of breath, they have chest pain. That can be any kind of chest pain. Usually what you always see in the movies that would only radiate into your left shoulder, left arm, is not true. Some people feel sensations here, some sensations in the belly. Mm-hmm. That would be a key symptom which is alarming. If you are exercising or even under resting conditions and you have chest pain, that's a key problem you have. And some symptoms are not so directly related to cardiac disease or heart disease, but people, for example, having swollen legs, right, especially in the evening, should also have a closer look at their heart, because that might be a first sign already that the heart is not able to pump blood sufficiently or in a good number or good volume through your body.
Okay, so if I feel a tingling, which is sort of like a prelude to a heart attack, or we read these articles on the web or in magazines that when you have this feeling or sensation in your left arm, it's time to go and see a doctor. But you're saying it's more than that. There are other parts that signal an alarm.
That is correct, yeah. So we're a little bit influenced by all these television shows what we have in emergency rooms, and everybody has the same symptom. It's always a shoulder pain in your left shoulder, in your left arm, but indeed it's more than that. Shortness of breath, which you did not experience before, swollen legs, discomfort, even stomach discomfort might be a hint that there's something wrong with the heart.
Brilliant. We're going to carry this conversation on throughout the course of 2014. I think it's a vital conversation because our heart basically keeps us alive. It distributes oxygen throughout our body, therefore making the other parts work. But we're going to have this conversation both in terms of the exercises that you think would help improve the heart muscles and keep it strong, as well as nutrition, what kind of foods to eat and how to cook them. Thank you very much, Doctor, for this insightful information. For all of you who are watching this webisode, please leave us your thoughts and comments. We will definitely broadcast it to you and with The Good Doctor on our future webisodes. Thanks for watching The Good Doctor on EasyLiving.com, where you can find anything and everything lifestyle.